Breathing is one of the most automatic movements of the human body, but it is also one of the most susceptible to being altered by pain, stress, or a respiratory condition. In many patients, respiratory dysfunction is not only due to a lung problem, but also to poor muscular coordination. This is where surface electromyography comes into play, a tool that will help you assess in real time which muscles are actually working during breathing, whether there is insufficient activation of the diaphragm, or if the accessory muscles are overcompensating. Knowing these patterns will allow you to identify the neuromuscular cause of the dysfunction, retrain breathing, and improve both the patient's respiratory function and postural control. Do you want to learn how to implement EMG in your respiratory assessments? Write to us using the link in the description and discover how mDurance technology can help you analyze and retrain your patient's breathing. Surface EMG allows you to assess three key aspects: respiratory muscle activity. You can record the activation of the main and accessory respiratory muscles, including the diaphragm, which is the primary driver of inspiration, or the external and internal intercostals, which stabilize and expand the rib cage, or the scalenes and the sternocleidomastoid, which act as accessory muscles useful in forced expiration or compensatory patterns. Second, muscular compensations and activation deficits. A well-performed electromyography will show you whether the patient is breathing diaphragmatically or thoracically, if there is hyperactivity of the scalenes, or if the sternocleidomastoid dominates over the diaphragm. 3. Re-education of the respiratory motor pattern. With real-time biofeedback, you can show the patient their activation pattern and visually teach them how to relax or activate the correct muscles. One of the most common mistakes in respiratory assessment with electromyography is improper placement of the electrodes. This generates noise in the recordings, inconsistent data, and makes it impossible to compare results between sessions or with other studies. For example, placing the diaphragm electrodes too low may pick up activity from the abdominal muscles, or placing them too far laterally may record interference from the serratus anterior. The key is to position the electrodes according to the patient's functional anatomy. To obtain reliable and clinically useful data, follow these anatomical references shown in the image. Let's look at an example of a normative breathing pattern. In functional breathing, the activation is, look at the image, the left and right diaphragm are activated more than the left and right external obliques. This means that the respiratory movement originates from the abdomen with minimal cervical involvement, ensuring an efficient and uncompensated pattern. Now let's look at the opposite example, compensation by the accessory muscles. A typical abnormal breathing pattern seen in the clinic is one where the external oblique dominates over the diaphragm. Look at the image. The left and right external obliques activate much more than the left and right diaphragm. This indicates that the patient is using accessory muscles to breathe, which can cause cervical stiffness, dyspnea, and chest pain. Surface electromyography is not just a diagnostic tool, but also a way to monitor the progress of treatment. If you work in respiratory physiotherapy, these are the scenarios where it will provide you with the most value. Patients with functional or restrictive respiratory dysfunction, cardiopulmonary rehabilitation where you need to assess muscle efficiency, patients on mechanical ventilation, or post-COVID where diaphragm re-education is key. Additionally, in general physiotherapy, electromyography will help you correct altered breathing patterns that interfere with abdominal stability and overall biomechanics. Therefore, electromyography applied to breathing allows you to precisely identify abnormal respiratory motor patterns, objectively assess the function of the diaphragm and accessory muscles, make clinical decisions based on objective data, and personalized treatment. And incorporating it into your sessions means moving from subjective observation to quantifiable evidence, raising the level of your intervention and the patient's confidence in your treatment. See you in the next post.